costing money and really believed it. But let me go to Congressman Sestak. And Congressman, I don't want to get into, you and I are friends, so I don't want to get into the whole business about whether or not there are death panels or not. Let's not even talk about that. But the idea of government bureaucrats or insurance company bureaucrats or Medicare bureaucrats getting between the patient and the doctor, that really is at the heart of the issue, isn't it?
I think is a major part of it. As you well know, right now, it's the insurance bureaucrat that gets in between the doctor and the patient. The insurance companies deny coverage. They actually ration coverage. You have a pre-existing condition, you don't get it. I can remember a woman came to my congressional office. She had cervical cancer. The insurance company said, we don't cover that type of chemotherapy. So what we do, and this is what's wrong with the Baucus bill, is we say, we're going to remove that rationing from the insurance companies and have everyone have the same benefits as Congress members have. The doctor will decide this. Now, we don't put a government out there who's a bureaucrat deciding. All we do is put one option out there called the public option that we probably should have called Blue Cross Blue Shield Jr. because it's not subsidized by the government. It's not mandated. It's got to compete on a level playing field. And what it does is breaks apart the Department of Justice's statement.
Hold on, Congressman.
92% of all insurance companies are non-competitive.
Okay, I got to do a reality check and put up some figures again, because if it doesn't cost anybody anything, what is the $829 billion all about?
Here's what it is. The difference between what happened the last 8 years is Tom and his compatriots added $4.5 trillion to our debt. This $850 billion, which is in the Baucus bill, and the same with the House bill, with one exception, is paid for by finding the revenues or the savings in Medicare, or finding the revenues actually in taxing certain persons.
Let me get to the
CEO figures.
Hold on, guys, gentlemen, both of you. Let me put you on hold, because we do have the CBO figures, and I want to put those up again. And Congressman Price, I'll ask you, first of all, let's put up the spending increases chart. This is new spending that the federal government will do to insure the uninsured. It's $829 billion, $345 billion for Medicare and CHIP, $461 billion subsidies for insurance purchases, and then the revenue increases. These are the new taxes to pay for all this. That only adds up to $311 billion, and we rely on spending reductions and this $196 billion other charge. Put up that $196 billion other charge. I want either one of you to answer, where is that $196 billion coming from?
It's coming out. Actually, and you know it, and so does Joe know it. And the reason that we do know it is because they've already put in place this Comparative Effectiveness Research Council, which is the rationing arm for this administration. There's no way that they can make this balance unless they decrease services to seniors. And everybody knows it that's been voting on this bill, and the fact of the matter is there will be a government bureaucrat between patients and doctors, and that's exactly what the intent of this bill is.
You know, Congressman Sestak, let's face it, you're right about insurance companies, but you didn't mention Medicare and Medicaid. They have bureaucrats between the patient and the provider as well. You're always going to have some form of that. Why do we want to add to that with a new program, the so-called government option?
The public option, and I have to stress this again, does not do anything different than the 20 or 30 other types of private plans that will be in the health insurance exchange. They all have to provide a minimum level of benefits. That's all it does. It doesn't say bureaucrats are in between any type of decision.
Well, if that's all it does, why do we have to pay $829 billion for it?
Now, let me speak to that. First of all, I'm not Tom, just a moment, please. I'm not going to defend the Baucus bill, but I will defend the House bill, which is $1.0 trillion. We found $550 billion scored by the CBO of savings in Medicare without decreasing any of the benefits. Number two, we found $500 billion where we went to revenues and raised them from individuals so that the only portion that's not paid is $139 billion because Medicare is doing a 21% cut of physician reimbursements this year that would have occurred anyway, even without the reform. The bottom line here is this does not put any government bureaucrat in any type of decision on health care. Number two, it is actually paid for and doesn't add to the debt.
If you can put that in the form of a written guarantee, I think a lot of Americans would appreciate it. But Congressman Price, Americans don't buy it. They first don't believe that you can create the public option for nothing without adding to the deficit.
Exactly.
They do believe it will cost. And secondly, they also do believe, with all the polls, I mean, not just one or two, I'm not just cherry picking, all the polls say they do believe that there will be more government bureaucracy as a result of this.
Well, sure there will. And we put it in writing. We put it in writing in the form of an amendment, and the Democrats voted it down. And that was that there ought not be a government bureaucrat between you and your patient, that patients and families and doctors ought to be making medical decisions. And the fact of the matter is, I'm not sure what Bill Joe's talking about, because H.R. 3200 from pages 16 through 25 clearly define exactly the amount of insurance coverage that each and every American must have if this bill passes, which means that medical savings accounts and cafeteria plans and high-deductible catastrophic plans will not only be unavailable, they will be illegal to sell in the United States. This is a remarkable government takeover of health care. The American people don't want it. We ought to step back, work together in a positive way, and put in place those positive solutions.
Congressman Sestak, go ahead.
Yes, look, what those pages do that Tom speaks about is say everybody is going to now have the same minimum level of benefits that you can want that every Congress member has. It actually takes our plan and says that's the minimum for everyone. Now, it doesn't do away with health savings accounts at all. They continue. It says you can buy more if you want, but everybody will have that level. And so doctors are going to be making the decisions with their patients. No, Tom, I'm sorry. Honest. You can have your own beliefs, but you can't have your own set of facts.
Read the bill.
No, I have.
All I ask you to do, Joe, is read the bill. The fact of the matter is that the federal employee health
guys. We
benefits
can't both talk at the same time. Go ahead, Congressman Price. Go ahead.
The fact of the matter is.
Actually, that was my time. All right.
Okay, hold on. I'll get back to you. You'll get the final word. Congressman Price, go ahead quickly.
All right.
The fact of the matter is the federal employee health benefits program that Joe and I have do not qualify under 3200 as a qualified health benefit plan.
Okay.
It is more lavish than the federal employee health benefits program.
Congressman Sestak for the final word. Go ahead, Congressman.
Absolutely. The minimum level of benefits that are stated in there are those that Tom has access to. Actually, I kept my TRICARE plan for the military because my daughter had a brain tumor and I just liked her doctors there. Now, we will join the public health care plan in a heartbeat as long as the doctor decides to join that network. In short, the big issue is this. 40 million Americans uninsured. We want them covered with a minimum level of benefits. But before we give them to insurance companies, with A-ration care, we say 94% of the health insurance markets, according to the Department of Justice, are non-competitive pricing markets. We're going to put a competitor out there to slow down the rise of premiums, and that's all we're doing. Fairness in the marketplace, everybody
Congressman, we have to leave it at that. Joe Sestak, Tom Price, who is also a medical doctor, by the way. Thank you, guys. I appreciate it.
Thank you.
Tom, enjoyed it, too. Thank you.
And Texas, you're